is, from my perspective, a critical role in the patient safety system. But there are many other organisations, many other players on the scene in terms of patient safety. There's the NHS trusts themselves and practitioners, but also the regulators. So I wondered, in your role, again, over the last 18 months, to what extent you've been able to engage with others with an interest in patient safety so that your aims are aligned and you're working well together.
Well, I see my role as part of that kind of golden thread to help align the system. And I've set up a network for execs from trusts to meet regularly so that I can understand from their perspective where safety is important, but also brought together a group of the leaders of patient safety organisations, which I co-chair, and we meet monthly. We're able to understand each other's roles and remits better, and also to work together to be able to get the messages through that really matter. And if I give an example, for example, with Martha's Rule, when I was asked to develop the policy to make Martha's Rule a success in England, the only way to do that was by working collaboratively with many other parts of the system. Because when we have a system problem, we need to find a system solution to it. So by working with the family, with patient groups, with providers, with regulators, with officials, we were able very quickly to establish what matters, to be able to pull together the recommendations which I made to the Secretary of State. And I'm absolutely delighted that Martha's Rule is now being piloted in more than 100 trusts have signed up to take part in that. This is by way that patients in hospital will be asked on a daily basis whether they're feeling well or ill, whether they're feeling better or worse than the day before, and how that information will be used in a structured way to predict and identify deterioration. And then all staff need to have access to a 24/7 critical care outreach if they've got concerns about the patient. And the Martha's Rule element is that patients and families will also have access to that same path for elevating concerns about deterioration. And not just in terms of the work that the trusts are doing, what I'm really excited about is that so many other parts of the healthcare system are also going to be doing actions that will support the implementation of Martha's Rule. And that includes the professional regulators, the Care Quality Commission, the Health Services Safety Investigation Body, and also parts of the system which represent members of staff and represent providers, such as the NHS Confed and NHS providers. And I think that by working together and developing systems that are going to be aligned, that are going to be coordinated and going to be supportive, we'll see a big step change in the way that patients' voices are listened to and that concerns are taken seriously.
You make an important point there about Martha's Rule, which I originally didn't envisage, which is it's not just about families being able to raise concerns, but it's also about medical practitioners on the ground as well. Just on that point about alignment, you said you saw your role as trying to bring that alignment to the wider safety system. Are there any particular points at this point in time where that alignment is not there, or they're high priorities because it's not working as well as it should?
Well, the first thing I would say about that is I think we don't really know the roles and the remits and the powers of all the different parts of the system. And so as part of the business plan that I've set out for this financial year, my team is going to develop the Patient Safety Atlas of Powers. And this is going to be a document that for the first time, I believe, is going to bring together all the different roles and the remits and the powers of the bodies across the health service, which are important in terms of patient safety. Because each part of the system does their bit. But unfortunately, because the remits may have gaps or even overlaps, it can create confusion, or even patients can fall between those gaps. And so I think that when we have a better understanding of who does what and how we can work effectively together, we'll be able to line up behind common objectives and then really make change happen.
Well, that mapping sounds really useful, because a lot of the time in regulation, we have system regulators and professional regulators. People talk about overlaps and regulatory burdens, but also they talk about gaps, because it's falling between the gaps where the harm occurs.